Your back does not hurt because you are old. Your back hurts because there is an inflammatory process happening inside the tissue surrounding your spine, and it does not stop at night. In fact, for most seniors with chronic back pain, the inflammatory activity is at its highest during the hours you are lying still and trying to sleep, which is exactly why you wake up stiff, aching, and in pain before the day has even started. There are two oils, taken together in a single dose before bed, that research shows can interrupt that nighttime inflammatory cycle, reduce it, calm it, so that by morning, your body has had hours to recover instead of hours to inflame. Today, I am telling you exactly what those oils are. Before we go any further, hit that subscribe button right now and drop a comment below with your age and your city. I read every single comment. And if you are someone who wakes up every morning with back pain that no one has been able to fully explain or fix, this video was made specifically for you. Stay with me. Welcome back. If you are new here, this channel is dedicated entirely to senior health in America, science-backed, practical information for adults over 60 who want to stay strong, mobile, and independent for as long as possible. Today we are talking about chronic back pain, and I want to start with a number that genuinely shocked me when I first saw it. According to the American Chiropractic Association, 80% of Americans will experience back pain significant enough to interfere with daily life at some point. 80%. For adults over 60, the number is even higher, and the vast majority of seniors dealing with chronic back pain have been through the same exhausting cycle. Doctor's appointments that end with a prescription. Medications that reduce the pain slightly, but come with side effects that create new problems. Injections that provide weeks of relief before the pain returns, sometimes worse than before. Physical therapy that improves mobility but barely touches the deep, aching pain that is worst first thing in the morning. And through all of it, nobody sitting across from them in that exam room has ever explained what is actually happening inside their spine while they sleep. So let me explain it, because once you understand the mechanism, the two oils I'm going to tell you about today will make complete sense. Chronic back pain in seniors is not simply a structural problem. Yes, disc degeneration, vertebral compression, and muscle weakness all play a role. But the reason the pain is so severe in the morning, the reason you wake up stiff and aching before you have done anything at all, is inflammation. Specifically, a sustained low-grade inflammatory process in the tissue surrounding the spinal discs, facet joints, and nerve roots of the lower back. This inflammation does not rest when you do. While you sleep, while your body is supposed to be repairing itself, inflammatory cytokines continue to circulate through the spinal tissue. Inflammatory enzymes continue to degrade disc cartilage. Nerve endings remain sensitized and reactive. And when you wake up, instead of feeling rested and recovered, you feel like your back has been working all night, because in a very real biochemical sense, it has. This is the nighttime inflammatory cycle that most back pain treatment never directly addresses. And this is precisely where the two oils come in. Before I tell you about the oils, and let me give you one more piece of science that will make everything click. Your body produces its most powerful natural anti-inflammatory compounds during sleep. Growth hormone, released primarily during deep sleep, drives tissue repair and reduces inflammatory markers throughout the body. Cortisol, your body's natural anti-inflammatory hormone, begins rising in the early morning hours to help you wake up and move. For this system to work correctly, for your body to use nighttime as a genuine recovery window, it needs the raw materials to do so. Specifically, it needs the anti-inflammatory compounds that counteract the cytokines and enzymes breaking down spinal tissue. When those compounds are absent or insufficient, the inflammatory process wins the nighttime hours. When those compounds are present, provided through the right nutritional and botanical sources taken before bed, the body has what it needs to shift the balance from inflammation toward repair, from deterioration toward recovery. The timing of before bed is not arbitrary, it is strategic. You are giving your body these compounds at the exact moment it enters its longest uninterrupted period of biological repair. And that timing, combined with the specific anti-inflammatory mechanisms of these two oils, is what makes this protocol so effective for seniors with chronic back pain. Oil number 1. Frankincense oil, also known as boswellia. Frankincense comes from the resin of the boswellia tree, native to parts of Africa and the Middle East. It has been used in traditional medicine for thousands of years, but what has changed what has made the medical community pay serious attention is the modern research on its active compound. That compound is called ACABA, acetyl-11-keto-beta-boswellic acid. ACABA is one of the most studied natural anti-inflammatory compounds in existence, and what it does, specifically for spinal and joint inflammation, is remarkable. ACABA works by directly inhibiting 5-LOX, the enzyme called 5-lipoxygenase. 5-LOX is responsible for producing a class of inflammatory compounds called leukotrienes. Leukotrienes are among the primary drivers of the chronic, low-grade inflammation that degrades spinal disc tissue, sensitizes nerve roots, and produces the deep aching pain that seniors with back problems experience every morning. Unlike NSAIDs, which work on the COX pathway and come with well-documented risks to the stomach, kidneys, and cardiovascular system, ACABA targets the 5-LOX pathway specifically. This means it addresses a different and in many ways more destructive branch of the spinal inflammatory process without the gastrointestinal damage or cardiovascular strain that long-term NSAID use produces. A clinical trial published in the journal Arthritis Research and Therapy found that boswellia extract significantly reduced pain and improved physical function in patients with chronic lower back and joint conditions, with results measurable within 7 days of consistent use. 7 days. Another study found that boswellia supplementation reduced the breakdown of cartilage in spinal discs, not just masking the pain but slowing the underlying deterioration driving it. For seniors whose discs have been compressing and thinning for years, this distinction matters enormously. Frankincense oil, in supplement form as boswellia extract capsules, is widely available at health food stores, pharmacies, and online. The research-supported dose is generally 300 to 500 milligrams of boswellia extract, standardized to contain at least 30% ACABA, taken once daily before bed. This is not an essential oil to be diffused or applied to the skin. This is an oral boswellia supplement, taken internally, to deliver ACABA directly into the bloodstream where it can reach the inflamed spinal tissue during the night. Always confirm the appropriate dose with your physician, particularly if you are managing other conditions or taking medications. Oil number 2, castor oil. This one surprises people. Most Americans know castor oil as something their grandmother kept in the medicine cabinet, something old-fashioned, something from another era. What most people do not know is that castor oil contains one of the most unique and powerful anti-inflammatory fatty acids found in any plant-based oil on Earth. That compound is called ricinoleic acid. Ricinoleic acid makes up approximately 90% of castor oil's fatty acid content, and it works on inflammation through a mechanism that is genuinely unlike most other natural compounds. Ricinoleic acid binds to specific receptors in the body called EP3 prostanoid receptors. When it activates these receptors, it directly suppresses the production of the prostaglandins responsible for pain sensitization and tissue inflammation. The same prostaglandins that are most active in the spinal tissue of seniors with chronic back pain. The same prostaglandins that peak during the nighttime hours, sensitizing nerve endings and maintaining the inflammatory state that produces morning stiffness and pain. A study published in the journal Phytotherapy Research confirmed that ricinoleic acid produced significant anti-inflammatory and analgesic effects, pain reduction, through this prostaglandin suppression pathway. But castor oil's benefits for back pain go beyond its internal anti-inflammatory action. Applied externally as a warm castor oil pack placed over the lower back before bed, ricinoleic acid penetrates deep into the soft tissue layer surrounding the spine. It reduces local inflammation in the muscles, ligaments, and connective tissue that become chronically tight and inflamed in seniors with long-term back pain. It improves lymphatic circulation in the lower back, helping the body clear the inflammatory waste products that accumulate in compressed spinal tissue overnight. And it has a natural muscle relaxing effect that reduces the protective muscle spasm pattern that many seniors with back pain develop, where the muscles surrounding the spine contract involuntarily to protect damaged tissue, creating a secondary layer of pain on top of the primary inflammation. The protocol is simple. Soak a piece of flannel or a soft cloth in cold-pressed castor oil. Place it over the lower back. Cover with a thin towel and apply a heating pad on low for 30 to 45 minutes before bed. The gentle heat drives the ricinoleic acid deeper into the tissue and enhances circulation to the area. Most people who try this consistently for 7 nights report a noticeable reduction in morning stiffness, often beginning as early as night 3 or 4. I want to tell you about Robin. Robin was 66 years old, a retired elementary school teacher from Georgia. She had spent 32 years on her feet in a classroom, bending, lifting, standing on hard floors for 6 hours a day. The back pain started seriously at 63, 3 years into retirement. An MRI showed 2 degenerated discs in her lumbar spine and moderate facet joint arthritis. Her orthopedic surgeon told her the changes were consistent with her age and her years of physical work. He recommended anti-inflammatory medication, core strengthening exercises, and, if the pain became unmanageable, steroid injections. Robin tried all 3. The medication gave her acid reflux so severe she had to stop taking it. The exercises helped her strength, but did almost nothing for the pain that woke her up at 5 every morning. She had 2 steroid injections. The first gave her 6 weeks of meaningful relief. The second gave her 3 weeks. She was told a third was not advisable. When Robin came to see me, she was not looking for a miracle. She told me very plainly, "I just want to sleep through the night. I want to wake up and not have the first thought of my morning be about my back." I explained the nighttime inflammatory cycle to her. I explained what ACABA does in the spinal disc tissue during the hours of sleep. I explained how ricinoleic acid in castor oil suppresses the prostaglandins that keep her nerve endings sensitized and her muscles locked in spasm through the night. She listened carefully. Then she said quietly, "Why has nobody explained any of this to me before?" I started her on 400 milligrams of boswellia extract, standardized to ACBA, taken every night before bed. And I showed her the castor oil pack protocol, 30 minutes on the lower back every night before she turned off the light. At day 7, Robin sent me a message. She said she had slept through the night twice that week without waking from pain, for the first time in 3 years. At 30 days, her morning stiffness had reduced significantly. She was getting out of bed without the 30-minute warm-up period she had come to accept as a permanent part of her mornings. At 90 days, she came in for a follow-up and told me she had started walking her neighborhood again in the mornings. Something she had stopped doing 2 years earlier because the pain made it impossible. Robin's results are not guaranteed for everyone, but her story represents something I have witnessed consistently. Seniors whose back pain was being managed but never truly addressed at the inflammatory root, who experienced genuine, lasting improvement when the nighttime inflammatory cycle is finally interrupted. That is what these 2 oils do, and that is why I am telling you about them today. Let me give you a clear, step-by-step nightly protocol that combines both oils for maximum anti-inflammatory effect. This takes approximately 45 minutes before bed. It requires no special equipment beyond items available at any pharmacy or grocery store, and it is designed to work with your body's natural nighttime repair cycle, not against it. Step 1. Boswellia supplement, taken orally. Take 300 to 500 milligrams of boswellia extract, standardized to at least 30% ACBA, with a small glass of water. Take it with a meal or a light snack if you are sensitive to supplements on an empty stomach. Boswellia is fat-soluble, meaning it absorbs more effectively when taken with a small amount of dietary fat. A teaspoon of olive oil, a few nuts, or a small piece of cheese alongside your supplement will significantly improve absorption. This is the internal component, delivering AKB into the bloodstream to work on spinal disc and facet joint inflammation throughout the night. Step 2. Castor oil pack, applied externally. Take a piece of flannel cloth or a soft cotton cloth and saturate it with cold-pressed hexane-free castor oil. Lie down comfortably and place the soaked cloth directly over your lower back, covering the area of greatest pain. Place a thin, dry towel over the cloth to protect your bedding. Apply a heating pad set to low or medium over the towel. Leave in place for 30 to 45 minutes. The gentle heat enhances penetration of ricinoleic acid into the deep, soft tissue layer and improves local circulation, accelerating the clearance of inflammatory waste products from the spinal area. After removing the pack, wipe the area gently with a warm, damp cloth. You can store the used flannel cloth in a sealed bag in the refrigerator and reuse it for up to 3 weeks before replacing. Step 3. Consistency. Both components must be used every single night for the protocol to work. One night will produce no noticeable result. 3 nights is where the prostaglandin suppression from castor oil begins to reduce morning muscle spasm. 7 nights is where most people report the first meaningful difference in how they feel when they wake up. 30 nights is where the full anti-inflammatory benefit of consistent AKBA delivery becomes established in the spinal tissue. This is not a quick fix. It is a nightly investment in the health of your spine, made at the exact moment your body is most capable of responding to it. Beyond the 2 oils, there are 4 additional strategies the research supports for seniors managing chronic back pain. Strategy 1. Eliminate inflammatory foods from your evening meal. What you eat at dinner directly affects the inflammatory environment in your body during the night. Processed foods, refined sugar, fried foods, and excess red meat all elevate inflammatory cytokine levels, working against the anti-inflammatory protocol you are building with the 2 oils. An evening meal built around vegetables, fatty fish, olive oil, and whole grains creates an anti-inflammatory nutritional environment that amplifies the effect of both boswellia and castor oil. Strategy 2. Magnesium before bed. Magnesium glycinate or magnesium citrate, taken alongside your boswellia supplement before bed, has well-documented muscle-relaxing and nerve-calming properties. It reduces the nighttime muscle spasm pattern that compounds back pain in seniors. It improves sleep quality, which directly supports the body's natural overnight repair mechanisms. And it is safe, affordable, and widely available without a prescription. Strategy 3. Sleep position matters. Sleeping flat on your back with a pillow placed under your knees reduces the compressive load on the lumbar discs and facet joints by up to 50% compared to sleeping flat without support. If you are a side sleeper, a pillow placed between the knees keeps the hips and spine in alignment and prevents the rotational stress on the lower back that worsens disc inflammation overnight. This simple positional adjustment costs nothing and can meaningfully reduce the compressive inflammatory trigger that contributes to morning pain. Strategy 4. Morning movement before standing. Before getting out of bed, spend 3 to 5 minutes doing gentle knee-to-chest stretches while still lying down. Bring one knee slowly to the chest, hold for 30 seconds, release, and repeat with the other side. Then both knees together. This gently mobilizes the lumbar vertebrae, stimulates the flow of synovial fluid into the facet joints, and begins to counteract the stiffness that accumulates during the night. Rising from bed immediately after waking, before the joints have had any movement, subjects compressed discs and inflamed facet joints to sudden load after hours of immobility. 3 minutes of gentle movement before you stand up can make a significant difference in how your first steps of the day feel. Let me set honest, realistic expectations because I want you to stay consistent long enough to feel the difference. Nights 1 through 3. The castor oil pack will produce a warming, relaxing sensation in the lower back during application. Most people find this immediately soothing. The boswellia is beginning to accumulate in the bloodstream and reach the spinal tissue. You may notice slightly reduced muscle tension when you wake up, but dramatic change at this stage is not expected. Nights 4 through 7. This is the window where most people begin to notice a real difference. Morning stiffness that typically lasts 30 to 60 minutes may begin to resolve in 15 to 20. The burning or aching quality of the pain upon waking, often slightly reduced in intensity. Sleep quality may begin to improve as the muscle-relaxing effect of ricinoleic acid reduces the nighttime spasm that disrupts sleep. Week 2 through week 4. Consistent daily use during this period produces the most significant and lasting results. The AKBA from boswellia is now consistently inhibiting the 5-LOX inflammatory pathway in the spinal tissue. The prostaglandin suppression from castor oil is established as a nightly baseline. Most people who maintain full consistency through 30 days report meaningful, sustained reduction in both the intensity and duration of their morning back pain. Not a complete elimination for everyone, but a measurable, genuine shift in how the morning begins. I want to leave you with this. Chronic back pain is one of the most isolating conditions a senior can live with. It limits the walks you take, the grandchildren you can lift, the mornings you wake up feeling like yourself. And most seniors dealing with it have been told, implicitly or explicitly, and that this is simply what aging feels like. That is not good enough. Your back hurts because of a specific biological process, a nighttime inflammatory cycle that has never been properly interrupted. You now know what that process is. You now know the two oils that the research supports for interrupting it. And you now have a protocol you can begin tonight, not next week, not after another appointment, tonight. Share this video with someone you love who wakes up every morning in pain, because the information in this video is free, and the difference it can make in someone's morning, in someone's life, is not. If this video gave you something valuable, please subscribe right now so you never miss a video that could change your health. Drop a comment below with your age and your city. I read every single one. And tell me, how long have you been dealing with back pain? What have you tried? I want to hear your story. Thank you for being here. Stay informed, stay consistent, and I will see you in the next video. The information provided in this video is for general educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment. This video does not establish a doctor-patient relationship. Always consult a qualified and licensed physician before beginning any new supplement, oil protocol, or health routine, particularly if you are pregnant, taking blood thinners, or managing chronic health conditions. Individual results vary. Boswellia supplements may interact with certain medications. Castor oil is for external use only unless otherwise directed by a physician. Statements in this video have not been evaluated by the Food and Drug Administration. B.